The rotator cuff is a group of tendons in the shoulder that help rotate the shoulder. In the front, we have the subscapularis. In the very top is the supraspinatus, and in the back we have the infraspinatus and the teres minor. These tendons are crucial for shoulder use and for everyday activities. A common problem with rotator cuffs is that they get pinched between the two bones. When the tendons get pinched between the bones, they get inflamed. It's what we call impingement syndrome or rotator cuff bursitis or tendinitis. This inflammation subsequently weakens the tendons, and that's how one gets a rotator cuff tendon tear. Another way that one can get a rotator cuff tear is with trauma, such as a shoulder dislocation. But the number one reason, or the most common reason folks come to see us, is for impingement syndrome, which is just pinching of the rotator cuff. The symptoms of impingement syndrome are usually shoulder pain over the outside part of the arm. One can have pain over the front where the biceps tendon is, because the biceps can get irritated as well with impingement syndrome. Patients will come in saying they can't sleep at night, it wakes them up, and they will also come in stating that it hurts when they reach out and grab certain things, such as overhead activity, or they're reaching into the back of the car. So what do we do, or what can we do for impingement syndrome? There are three main things to start with. The first is an anti-inflammatory medication, such as Motrin or Aleve. By decreasing inflammation around the rotator cuff, you'll have less pain. The second is physical therapy. Therapy helps a lot to do these same things as well. And the last option is a corticosteroid injection. If you put an injection into the bursa, it will decrease the inflammation and hopefully get you over this problem. Every patient is different. Some patients respond really well to the anti-inflammatory medications. Others respond better to the physical therapy or the injections. If your shoulder does not get better with these, the next step would be to get an MRI of your shoulder or an ultrasound to assess the tendon. Is it really inflamed, or is there a small tear or a larger tear that needs to be addressed surgically? So a common question I get is, my rotator cuff is torn. How do you fix this rotator cuff tear? This is a model. This small portion here is your torn rotator cuff tendon, and this needs to be reattached back to the bone. Here is the area where the rotator cuff attaches, and this tendon needs to be anchored or sutured back down. A way that the rotator cuff is repaired is we use these anchors. The anchor is placed into the bone, and we screw this anchor down into the area where we're going to fix the rotator cuff tendon. This anchor has suture coming through it, and once we deploy the anchor, the suture is coming out from the area of the rotator cuff that I need to repair. The suture will then be passed through the rotator cuff, tied back down, and that's how we repair the rotator cuff tendon. I hope this helps with your understanding of the rotator cuff, its problems, what can be done for your rotator cuff, and if all else fails, what can be done surgically. If you have continued pain or discomfort, please visit your local orthopedic surgeon.